Anaphylactic shock is a life-threatening condition in which patient can lead to unconsciousness or even death. So I'm going to explain this. Anaphylactic is a severe, potentially life-threatening allergic reaction. It occurs within seconds or minutes of exposure to something you are allergic to, such as peanut or the venom from a bee sting. The fluid of chemical released by your immune system during anaphylaxis can cause you to go into shock. Your blood pressure drops suddenly and your airways narrow, blocking normal breathing. Signs and symptoms of anaphylaxis include a rapid weak pulse, a skin rash, and nausea and vomiting. Common triggers of anaphylaxis include certain foods, some medications, insect venoms, and latex. Anaphylaxis requires an immediate trip to the emergency department and an injection of epinephrine if anaphylaxis is not treated right away. It can lead to unconsciousness or even death. Symptoms. Anaphylaxis symptoms usually occurs within minutes of exposure to an allergic. Sometimes, however, anaphylaxis can occur a half hour or longer after exposure. Anaphylaxis symptoms include skin reaction, including hives, along with itching and flushed or pale skin, almost always present with anaphylaxis. A feeling of warmth, the sensation of a lump in your throat, constriction of the airways, and a swallowing tongue or throat, which can cause wheezing and trouble breathing. A weak and rapid pulse, nausea, vomiting or diarrhea, dizziness or fainting. Their causes are your immune system produces antibodies that defend against foreign substance. This is good when a foreign substance is harmful, such as certain bacteria and viruses, but some people's immune system overreact to substances that should not cause an allergic reaction. When this occurs, the immune system sets off a chemical chain reaction leading to allergy symptoms. Normally, allergy symptoms are not threatening, but some people have a severe allergic reaction that can lead to anaphylaxis. Even if you or your child has had only a mild anaphylactic reaction in the past, there is still a risk of more severe anaphylaxis. A number of allergens can trigger anaphylaxis depending on what you are allergic to. Common anaphylaxis triggers include certain medication, especially penicillin, foods such as peanut, tree nuts, walnut, pecan, almonds, cashews, wheat in children, and fish, shellfish, milk and eggs, and insect stings from bees, yellow jackets, wasps, hornets, and fire ants. Less common cause of anaphylaxis includes latex medication used in anesthesia and exercise. Anaphylaxis symptoms are sometimes caused by aspirin and other drugs such as ibuprofen, naproxen, and the intravenous IV contrast used in some X-ray imaging tests are too similar to allergy-induced anaphylaxis. This type of reaction is not triggered by allergy antibodies. Anaphylaxis is triggered by exercise and is not common and varies from person to person. In some people, aerobic activity such as jogging triggers anaphylaxis. In other, less intense physical activity such as walking can trigger a reaction. Eating certain foods before exercise or exercising when the weather is cold, hot or humid also has been linked to anaphylaxis in some people. Talk with your doctor about any precaution you should take with exercising. If you don't know what triggers your allergy attack, your doctor may do tests to try to identify the offending allergy. In some cases, the cause of anaphylaxis is never identified. This is known as idiopathic anaphylaxis. The risk factors there are not many known risk factors for anaphylaxis, but some things that may increase your risk include a person's history of anaphylaxis. If you have experienced anaphylaxis once, your risk of having this serious reaction increases. Future reaction may be more severe than the first reaction. Allergies or asthma. People who have either condition are at risk of having anaphylaxis. A family history. If you have family members who have experienced exercise-induced anaphylaxis, you are at risk of developing this type of anaphylaxis is higher than it is for someone without a family history. Complications. An anaphylactic reaction can be life-threatening. When a severe attack occurs, it can stop breathing or stop your heartbeat. In this case, you will need cardiopulmonary resuscitation (CPR) and other emergency treatment right away. Treatment and drugs. During an anaphylactic shock, an emergency medical team may perform cardiopulmonary resuscitation (CPR) if you stop breathing or your heartbeat stops beating. You may be given medication include epinephrine to reduce your body allergic response, oxygen to help compensate for restrict breathing, intravenous antihistamine and cortisone to reduce inflammation of your air passage and improve breathing. A beta agonist such as albuterol, Ventolin, salbutamol to relieve breathing symptoms. Subscribe our channel for more medical videos and be healthy and be a health provider.